All right. Good morning, everyone. I just wanted to introduce our speakers for today. So I'm Neha. It's very nice to meet all of you. Thank you so much for joining in today. We also have Perla, the CEO of CommunityConnect Labs, and Eric Stone, who is our Chief Technology Officer. So just very quickly, I wanted to go over the agenda for today. We're going to start out talking about the pain points in COVID-19 contact tracing. We'll also go over what to look for in a contact tracing case management solution that will set you up for success, as well as learn about some of the COVID-19 solutions from CommunityConnect Labs. Finally, we'll be having an open Q&A where we can answer any questions that you may have for us. I just hope that you guys are going to ask a lot of questions. Like, these are unprecedented times, and a lot of you have been tasked with the responsibility to scale up your contact tracing program. And it's only natural that you're going to have a lot of questions around privacy and how you can reach a large number of people. How do you get the maximum number of people to respond in the least amount of time? So we've had a lot of people reach out to us with questions. And we thought, what better way to address some of these questions, as well as share it with a broader group of people. So that's kind of the reason for today's webinar. Again, feel free to ask us any questions. They'll help all of us. In terms of how do you go about asking your question, you just need to type it out in the Zoom Q&A panel. That's, you can find that at the bottom of your screen, and we'll be answering all your questions at the end of the webinar. And just a reminder, we'll also be sharing this recording as well as the slides in the next couple of days. So, you can always revisit the information and the answers at your own pace. So with that, I think it's over to you, Perla.
Thanks. We're so glad to see everyone here from fantastic DHS and public health agencies. You guys are really the leaders right now in this crisis. Everyone is looking to your department for your guidance and helping people through this extraordinary times where public health is taking a limelight like never before. As Neha has said before, we understand these incredible challenges of setting up a new system in a very high-risk environment, being able to scale up like you've never been able to before, needing to get people to respond faster, making decisions based upon that data, and training up a huge workforce in a small amount of time. We wanted to share our experience because we have done similar campaigns like this just in the past couple of months with census, where we also needed to help government stand up their systems quickly to do census outreach, train hundreds and hundreds of local census outreach folks to do census outreach, teach people about a complicated and also privacy-ridden issue of responding to government surveys. And that's why we wanted to do this webinar today, to share some of our experiences with you, as well as share our technology solution for contact tracing. Next. So CommunityConnect Labs, who we are. We work with governments, state governments, as well as local county governments to engage your communities. And we are also a nonprofit. And so our mission is very much aligned with yours. It is to ultimately improve the welfare of our residents in this country. Next. Our expertise, as I mentioned, we worked on census, educating, activating more than 50,000 hard-to-count populations to take the census. We've worked extensively in public health, conducting surveys on diabetes, health insurance, children's health, focused on vulnerable populations. So we know the challenges of data collection with the communities that are hardest hit right now by COVID. We've also worked in mental health. We have conducted mental health post-hospital discharge surveys, as well as we're doing a current project with the state of Illinois on mental health referrals. Some other areas where we've worked with vulnerable populations are in workforce training, public charge assistance, as well as utility benefits. Next. We really understand kind of the challenges that government faces. And so what's unique about us is that we put together a cross-functional team that will support every project. So in addition to just getting software, you also get account management, a ton of implementation help, as well as training, data analysis, data reporting, as well as obviously engineering support. Next. We know that these types of supports are really critical to the success of outreach and engagement programs such as contact tracing. We know the importance of training. In census work, we have done over 50 webinar trainings focused on different segments of the hard to reach communities, including Latinx, Asian Americans, African Americans, seniors. We have trained community health workers, including Spanish-speaking promotores. So we understand you don't just train once, you train continuously, because there are people who, when they first start the job, they listen to part of the training, and then once they actually get into the job, they realize they need additional training. And we do that on a frequent basis. We understand the challenges of training, and we are here to support you throughout the entire training life cycle. Messaging, we understand the importance of messaging, especially times like this. Creating messaging collateral, creating culturally sensitive, persuasive messaging to encourage populations to participate. And then our engineering is really focused on providing very rapid, responsive engineering to you, so that you can, if you need changes to your system, it doesn't take weeks or months, it takes hours or 1 or 2 days. And then lastly, data management. We are very familiar with the HIPAA issues around data management for public health and health issues, as well as we understand your need for data management, data standardization, and cleaning. So we are here to support all of these aspects of your contact tracing program. Next. Our clients, we love working with DPH and DHS, and here is just a sample of some of our government clients, as well as some of our other social sector services provider clients. Next. So we want to talk a little bit about the contact tracing pain points. Many of you guys may already know this from your work in contact tracing for TB or foodborne illnesses, but I wanted to kind of review some of the pain points that may not be as apparent to all the folks that you're going to be training, for instance, to do this work. One, first of all, contacts may be unresponsive. It may require multiple attempts to reach a contact. And this is probably one of the most time-consuming aspects of contact tracing, is people call and their calls don't get responded to, or people do not pick up their phone. And for a variety of reasons, maybe they don't recognize the phone number that it's coming from, or they are too busy. So in our experience, it's really important to prep people that are receiving these calls to know to expect a call, and even provide a phone number, a branded phone number that they could expect this phone call from. And then a second solution is to schedule interviews using, for instance, text messaging, to let people know, hey, are you available at this time for an interview call? And these are ways to reduce the time-consuming attempts to reach a contact. For immigrants and minorities, as you know, there is a big fear of participating, especially giving out contact information of their family members and their friends. Not only is there a fear of kind of, mistrust of government and how government may use that data, but there's a fear, just very pragmatically, of their contacts being into forced quarantine, and those contacts not being able to go to their job or be able to take care of their family. Lastly, for immigrants and minorities, sometimes there are language barriers, and we find that in a lot of our public health outreach work, the people who are the hardest to reach are also those people who are linguistically isolated. And so some of the solutions that we've seen work is to hire people with those linguistic skills, as well as kind of the cultural competency skills and motivational interview skills. So people who are persuasive and can speak those languages of those communities and really inspire them to provide their contacts. Next. Another pain point that we've seen in reaching hard to reach vulnerable populations is that often it requires a variety of communication methods. So, you know, for professionals, you know, we're used to using email as a frequent mode of communication. But for these other populations, we need to think about different ways to reach them. So I'll just give an example. You know, young and mobile populations are much more willing to install an app, but are actually less likely to answer a phone call. Older populations, for instance, are more willing to answer a phone call, but less willing to install an app. So in our experience, what we try to do is provide multiple ways for people to get connected to you, whether that is providing a mobile app, calling people by phone, reaching people by text. Each of these different methods of communication will be preferred by a different segment of your population, and you're trying to reach everyone. So it's really important to have a complete set of communication tools at your disposal. Next. So what do you look for in a contact tracing solution? I know many of you guys already have a solution that you may be already using at your department for the TB contact tracing or foodborne illness. This time around, we all recognize the need for solutions that scale and can really meet this moment. So we really recommend that you look for vendors who can quickly customize and implement a solution. So we're talking about days, not weeks. We realize you're under a lot of political pressure to get a contact tracing program up. Two, look for vendors who can really provide comprehensive support. So you're not looking for just someone who can give you a piece of software and say, hey, okay, you guys can go and do it. Or, you know, someone who can provide you a piece of software and then it'll take, you know, weeks to customize it. You're really looking for someone who can come in, have something ready for you to launch almost immediately, and then who can also provide project management, onboarding of your staff, training of your staff, technical support. You're looking for someone ideally with public health experience, you know, previous experience doing public health surveys and engagement, especially with diverse audiences, people who understand the language barriers that your staff is going to need to overcome in order to communicate with the populations they're trying to persuade to give them all their contacts. So you're looking for more than a piece of software. You're looking for a lot of project management support, especially if your department, you know, does not have a lot of resources right now for, you know, project management, training, data management, data analysis. Like, you want to try to ideally find a vendor who can give you all of that. Next. In terms of technology, you know, you're looking for something that is proven and scalable. So not a brand new technology, but something that probably already exists and has a successful track record. You want something to be easy to train on and does not require technical know-how. There's a lot of software out there that is rather difficult to use, and I can tell you from the experience of, you know, training community organizations and doing even census outreach, some of the software products that they were using was not easy for their, you know, newly hired staff to learn, and it took weeks for their staff to learn. You want to find a software a platform that is easy for your staff and potentially even volunteers to learn. You want a solution that interfaces with your existing system. So you have a back-end database database, for instance, or you have other contact tracing data from previous campaigns, you want to be able to interface with those existing systems. You want something that is HIPAA compliant and ideally cloud data storage so it's cheaper. You want a solution with strong role management so that you can differentiate between a staff who's on the phone constantly versus a manager who has permissions to look into the productivity of the different staff contact tracers. And you want a lot of reporting functionality for that manager to be able to pull reports that they can use for your different government hearings. Similarly, you want dashboards to help you assess success and know where you are. You want to have easily configurable scripts and alerts that are built into the platform. So it'll be very easy for someone to log in and have a script for the questions that they're asking people, and to be able to input those answers. And then you want, features, communication features, such as automated two-way messaging to maximize the productivity of your contact tracing staff. I think, one of the biggest issues around this is how manual this process is currently, and how can we really maximize the productivity of the staff by leveraging some technology tools such as two-way texting to be able to schedule interviews or to alert people to do follow-up surveys on their own without someone having to, manually call people every day to remind them to do their survey. And lastly, you want to find a solution that can communicate to people in multiple languages. That is going to be key to reaching some of the most vulnerable and most likely to be hit with COVID-19 impact. Next. All right, so with that, I am going to hand this to Eric Stone, our CTO, and he's going to give you a quick demo of the solution that we have for you for contact tracing, and then we can talk more about some of the services and your questions after that.
Thank you, Perla. So we're going to go look at some of the technology that we're bringing to the table here. And really what Perla said, the most important thing here is raising the productivity of your contact tracers and your case researchers. How can we get 45 minutes or an hour worth of work time down to 10 or 15 minutes and make people, 2 or 3 times more productive? And so the solution that we're presenting today is a combination of products. It's a CRM solution that's been in the industry for 16 years, is HIPAA compliant, has today about 300,000 organizations using the product, including some departments of health. And then one of the most important things is just the customizability of the system. Just a few hours to customize the fields and the screens for each of the roles and the different people who are going to be using the product. And then, providing also the comprehensive training for your staff and support just to keep things going. So the system has CRM and all of the data management, but we've also enabled it with two-way call center features, messaging, calling, and email as well. Being a HIPAA compliant system, a lot of the times when you're doing texting or email, those are going to be secure links or links that just go to secure forms. But there's a lot that you can do as well with texting that isn't HIPAA, doesn't fall under HIPAA. And so we'll take a look at some of those features. And so really, you've seen a lot of these CRMs. This is no different. It's a web-based, browser-based system. Puts all of that data into one place so that contact tracers, case researchers, and everyone can work together. And just an easy to use dashboard that we'll see in this video. You can see here's some patients with different symptoms. We're clicking through. You can easily customize the look and feel and the data very simply. So to make things a lot faster, we've included one-click calling and also SMS and also email integration. The idea is that, we can take the alerting, the notification, the data collection, and really shorten that. In this case, even clicking and just calling on a contact or scheduling a call It's just really easy to do within the system. So it's simply a matter of clicking a contact, clicking the phone icon, selecting their phone number, and then either calling now or scheduling a call for later. And so the call is scheduled. So as I said, the system's easily customizable for any fields, any type of role that you have. If I'm a contact tracer, I might come in and see one view versus a case researcher, I'd get another view. So having those customized views is really important as well. And this is just us working in one of those customized views as a contact tracer. You can see different fields like data first rapid test, date symptoms developed, and just whatever the contact tracers need to do, filling out whatever information that's important. So some of the automation that I talked about, which is automated forms, these forms can either be sent out via SMS with a secure link or email. Additionally, these also work as call scripts for the staff. So we saw the click to call happening, and then the staff can read from that same form that's used to distribute as a call script. So we also have SMS built into the system. It could be something as easy as reminders and instructions. You see here, there's an example of an isolation ending and reminder instructions for people once they've reached the end of their quarantine. Also an initial SMS that might go out that might tell people about social assistance, food and shelter options that are available to them for their support. So we can also automate the surveys and the data collection either securely with an app, with SMS. We also have these, pretty important, powerful chatbots. And so people can basically fill out the information as if they were on a chat, for example. And then we've talked about a mobile app as well. This kind of ties things together for a large part of the population where entering information might be not as easy over the phone or with a web form. So having an app where people can report things like their temperature, their vital signs, their level of cough, or even symptoms is just another way to tie things together so that takes a lot of that responsibility and time away from your contact tracers and makes your system a lot more efficient. And then all of that data gets reported up into the dashboards that we've seen. And we've got reporting as well. Now the reporting is something that will require a higher level of customization for your particular business needs, whatever requirements you have around that. But this is hours, if not just a day or two of customization in the CRM. This is not weeks of customization. This is also an example of data coming back from the app showing people's temperature, any symptoms that they might have, et cetera. And all this is in real time getting reported back from people out there who have the app and reporting their symptoms into the system. Okay, I think I'm going to hand it back over to Perla now.
Thanks. Thanks, Eric. And someone asked a question if you will get a copy of this presentation. And yes, we will send out this presentation for everyone after this, this call. Eric, thank you so much. I think that technology is really incredible because you've built something that is an end-to-end complete solution, not only for contact tracers, but also that portion of the population that wants to use a mobile app and could also help with the self-reporting. That would reduce the workload on contact tracers quite a bit. I also want to mention, along with software, we are a nonprofit. And so what we recognize is that we not only are here to help you implement the process, but we're here to ensure your success. So we're really here for you every step of the way. We provide an entire project management team. We have account manager, we have data scientists, implementation managers, engineers to help you be successful in your program. What we do is we work with you on planning, training, implementation, with weekly check-ins, as well as ongoing coordination to ensure a well-governed and successful program. We realize how huge of a task this is on your shoulders, and we are here to help with our cross-functional team. We also will be here to provide you with all the training, including real-time sessions, along with recorded videos, and then training materials in different languages. As I mentioned, we think that training is a really key component to this entire solution, because not only do you have to hire the right staff people to do this work, but you need to train them, because the pain points, as we've discussed, around reaching vulnerable populations and getting their participation is really a one that you guys have probably experienced. It is real, and it's only going to be magnified because of the implications of COVID-19 and potentially being, having your friends and family, forcibly quarantined and not being able to go to their workplaces. So the stakes are high for the people that you're trying to contact. And so the training not only is about how to use the product from a technical point of view, but also about culturally competent messaging and motivational interview skills, all those kind of soft skills that we know is vital to the work that you do in ensuring the trust of the vulnerable communities that you work with. Next. We often get this question about pricing. We know you're under a lot of stress with pricing. We are a nonprofit, and so we really try to reduce the costs for you as much as possible. No one here is making money from providing these solutions. We provide all-inclusive pricing, including all the services to help you be successful, as well as the software. So the software, as Eric has mentioned, is we have the CRM database for you, as well as the mobile app. Two-way texting is included. We include all the reporting, volunteer training, as well as professional services that we mentioned before, and technical support. And the prices start at $15 per month per contact tracer. So it's really affordable. Anyone who has difficulties with that pricing, come talk to me. We also may be able to get some foundation support depending on what location you're in to help with any budget needs. But we're really here to make sure the pricing is simple, affordable, and all inclusive, because we know for some vendors, there's a lot of add-ons for training and things like that. And we want to make sure that everything is included, because we're here to be successful, to help you be successful in your contact tracing. Next. I think that's it. Great. All right. I think it's time for Q&A.
Thank you, Perla, and thank you, Eric. That was extremely, extremely helpful. I'm just going to open up the floor for any questions. I just want to let you guys know that we have received a couple of questions already prior to the start of the webinar. So, we're just going to give, all attendees maybe a couple of minutes to enter their questions. And, in the meantime, Eric, maybe you can maybe you could talk us through some of the questions that we've received already. So the first question that we've gotten is around customization. So, how customizable is the tool, when you have all sorts of different roles and people using the software?
Yes, so it's easy in the software to define the roles, and then all of the screens are basically drag and drop fields. So if you don't like a field or don't want like the birthday field, you can rearrange it or move it around. You can add as many fields as you want. So customization is very fast because of that. It's, the system's designed to customize fields per role very easily. So I think that the only thing that's not as customizable is the reports. So the reports do take, hours to customize from a software development perspective, but there's no code required for most of the customizations in the system.
Thank you. The other question that we've received from a couple of people is how long does it take to actually implement? So if I were to sign up today, how soon can I get started?
So we would move into the customization of the CRM immediately, and within a couple of days, we can have the contact tracing data layouts, all the fields done, everything there. And then I think it's just a couple of more days to customize the outbound SMSs and some of the other things like reports that I've discussed. So, you know, within a week, you can get it up and running very quickly.
Wow, thanks so much, Eric. The other question that we've gotten is around the security and the scalability of this solution. So if you could shed a little more light on the topic, please.
Sure. So everything is hosted at AWS. We've gone through HIPAA certification. I am HIPAA certified as well. And then all of the redundancy and backups are done as per those requirements as well. So we can also provide a service level agreement. The other thing too is I think we're running on AWS's GovCloud. So if there are any requirements around standards like that for hosting, I think we meet or achieve all of those. So we should be good.
That's great. Thank you so much, Eric. So we don't have any more questions.
We see a question. There's a question here about the pricing model. Thank you, Suresh. Yeah, so the pricing model is based upon how many contact tracers you have. And we find that to be the most flexible model because you might, every county and state has different numbers of contact tracers that they're planning to hire. So it is $15 a month per contact tracer on your team. So hopefully that is a flexible model for you guys.
Right.
Any other questions? Maybe we can leave folks with with my email if people want to email me afterwards if you have any other questions. So it's just, I'll just type it here. Oh yeah, we have info. Yeah, we have the info one, and then you can also reach me directly if you want at Perla at CommunityConnectLabs.com.
And I'm going to be sharing a follow-up email with, either this evening or maybe tomorrow. So I'll make sure that I share all the slides from today. We'll have the recording, and I'll make sure that I add Perla's email address as well. In the meantime, if you guys would like a little more information, feel free to email us, whether it's at perla@communityconnectlabs.com or info@communityconnectlabs.com. And you'll see on your screen that we've shared a URL. So if you want to read a little more about the product, feel free to do so. And we hope that we'll hear from you guys soon.
Good luck, everyone.
Thank you.
Thanks, everyone.
Thank you, everybody.
Bye.